With the majority of people who are infected with coronavirus, their experiences will be mild or asymptomatic, which can be treated at home. So doctor, if someone was experiencing the telltale signs of the virus, what should they do to feel better?
If you experience a fever or a new continuous cough, you should self-isolate immediately. Those experiencing a mild illness don't need to seek medical attention. Avoid
and what do
sharing
you do
towels,
while you're
crockery,
in self-isolation?
cutlery, or bed. As with other viruses such as colds and flu, taking it easy and looking after yourself are crucial to your recovery. So you should drink plenty of fluids, drink enough water so that your pee is pale, clear colour. Avoid alcohol, as this will make you more dehydrated. If you smoke, you should try to stop for good. Get plenty of rest. You should isolate yourself at home if you have any symptoms of coronavirus and avoid any strenuous activity whilst you are unwell.
Are there any medications for COVID-19?
There is not currently a cure for COVID-19 or vaccine against coronavirus. The aim of treatment is to manage and reduce symptoms until you have recovered. Most people, around 80%, have an asymptomatic or mild infection, which can be treated at home. In this case, you should self-isolate for at least 1 week until you have recovered. 1 in 5 people who contract COVID-19 will require hospital care. Around 15% of cases experience severe infection requiring oxygen to help with respiratory symptoms. 5% experience critical infections requiring ventilation. Those at a higher risk of severe or critical infections include older people and those with underlying health conditions.
What painkillers are suitable?
To relieve pain and fever, you can use painkillers like paracetamol. France's Health Minister, Olivier Véran, recently commented that non-steroidal anti-inflammatory drugs, NSAIDs, could aggravate the infection. These medications include aspirin, ibuprofen and naproxen, amongst others. Currently, there is no conclusive evidence that NSAIDs will make a coronavirus infection worse. But until there is more information available, you should stick to other painkillers to treat a fever or headache if possible. However, if you have been prescribed an NSAID to treat a health condition, you should continue to take it until you are told not to. Some of the medications and treatments you might use to treat colds and flu will also help with coronavirus symptoms. Cough medicines or cough suppressants can help reduce your cough. However, some of these preparations may or may not contain paracetamol or other painkillers, so always read the label. Throat lozenges and remedies like honey or lemon may improve a sore throat.
What about homemade remedies?
Although there is no robust scientific evidence that homemade remedies work, some people do find them useful. There is no harm in making small quantities of homemade remedies using lemon, ginger, honey or black seed oil in the form of a warm drink to soothe the throat and increase fluid intake, as anything in too much quantity can also be harmful. It also must be noted that these remedies could also distract you from doing the thing which really helped to stop the infection, such as thorough hand washing and social distancing.
What are your thoughts on steam inhalation?
There is not very much evidence that this helps. However, some people find it useful. It is very important to be careful to avoid burns and scalds, particularly with children. A safe way of inhaling steam is to sit in the bathroom with the door closed while running a hot shower to make the room steamy.
Antibiotics.
If you have antibiotics lying around at home, do not take them to treat coronavirus. As it is a virus, antibiotics will not improve coronavirus. You should never take antibiotics which haven't been prescribed for a certain condition.
COVID-19 cures?
There are many natural cures and herbal remedies floating around the internet and in health stores. Currently, we aren't aware of any remedy to cure COVID-19, so don't be fooled by the miracle treatments some people are trying to sell. They could contain harmful ingredients and could also distract you from doing the thing which really helped to stop the infection, such as thorough hand washing and social distancing.
And when do you seek medical attention?
If you're not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. the patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting, or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change.